February is Wear Red for Heart Health. According to the Centers for Disease Control and Prevention, more than 600,000 people in the United States will die from heart disease this year. More than 930,000 Americans will have a heart attack. For these patients, regular exercise and healthy food choices are crucial to a healthy heart. The Rutland Regional Medical Center is helping these patients with education and supervised exercise at its Cardiac Rehabilitation Center. Every Monday, Wednesday, and Friday, the treadmills, rowing machines, and bicycles serve as boot camp for patients recovering from heart procedures.
We individualize the program, although we've got several patients exercising at the same time. The program is individualized to the patient by his diagnosis, by his comorbidities, meaning whether or not they have high blood pressure or diabetes or whatever the case may be, and by their ability. All of the patients that come into cardiac rehab have to have a exercise stress test, generally a low-level exercise stress test, and from that stress test we learn whether or not there are areas of their heart that are not getting enough oxygen, or that their heart is safe and it looks good to go.
Every patient is hooked up to heart monitors while exercising. During the morning session, nurses check each patient's blood pressure 4 times to record any changes, spikes, or dips. Gary Roth, Killington's fire chief and therapist at the Rutland Visiting Nurses, is the youngest patient in this group. Roth spends 3 days a week at the Rehabilitation Center, recovering from a heart attack. He says the program is helping speed his recovery.
The program helps you to feel comfortable and not worry while you increase your ability to do what you used to do.
For Roth, it's not only the regular exercise he'll have to maintain after the program, but the food he eats as well.
You have to make a lifestyle change.
Education is a major component to the cardiac rehab program. During the different sessions, the registered nurses give PowerPoint presentations to help the patients understand different elements of heart health and how small changes can make a big difference.
Cardiac rehab is not an exercise program. Cardiac rehab is an education program. We focus on the risk factors that make a person more likely to develop coronary artery disease, and so we have 10 different classes that we teach on that, and one fun thing that we do. We spend a lot of time on food choices because they're most difficult for people. The food industry makes it easy for you to go down the aisles and grab a box of crackers and never think about what's in them.
Nurse Laura Williams says food is key to heart health. She says if you don't know or can't pronounce one of the ingredients on a food label, then chances are it's not the right choice. Nurse Williams says it's better to be proactive and knowledgeable about heart health than wait until something happens.
First tip is try to get out and do some kind of exercise. Brisk walking is perfect for 30 minutes most days of the week. You don't want the exercise to be so hard that you're huffing and puffing. You start slow, you build up, you're out there for 30 minutes, 5 to 6 days a week. Learn how to read a food label. Learn what is food and what isn't.
The Cardiac Rehabilitation Program has 6 and 12-week sessions. If you'd like more information, you can call the Medical Center or visit its website at www.rrmc.org.